What if I told you that something millions of seniors do every single morning, something that feels completely harmless, maybe even healthy, is quietly damaging their kidneys? Not over decades, not in some distant future, right now, today. And the truly alarming part is that by the time most people find out, the damage has already been building for years. The kidneys don't send obvious warning signals early on. They don't announce their distress the way a bad knee does or a tight chest does. They just quietly struggle and struggle and struggle until one day a routine blood test comes back with numbers that change everything. If you are over 60, this video may be one of the most important things you watch all year, because what we're talking about today is not rare. It is not extreme. It is hiding inside the morning routine of an enormous number of seniors across this country, and most of them have no idea. Before we go any further, I want to say something directly to you. If you've been feeling more tired than usual lately, if your ankles seem a little puffier than they used to, if you wake up in the middle of the night to use the bathroom more than once, or if your urine has looked foamy or darker on certain mornings, please don't brush those things off as normal aging. They may be nothing, but they may also be your kidneys telling you something. And today, we are going to listen. If this is the kind of honest, research-grounded content that helps you take better care of yourself, please take a moment to hit that like button and subscribe to this channel. At Dr. Silas Redford Wellness, we are committed to bringing you the information that truly matters for this stage of life. The kind of information that sometimes doesn't make it into a 10-minute doctor's appointment. You deserve more than that, and we're here to give it to you. Now, let's talk about the morning habit. And I want to approach this carefully because when people hear morning habit that damages kidneys, they often assume we're talking about alcohol or cigarettes. Something obvious. Something they can immediately distance themselves from. But that's not what we're discussing today. What we're discussing is something far more common, far more accepted, and for exactly that reason, far more dangerous. In a moment, I'll name it directly. But first, I want you to understand something about your kidneys. Because once you understand what they're actually doing every day, what I'm about to share will hit very differently. Your kidneys are two fist-sized organs sitting just below your rib cage, one on each side of your spine. They filter your entire blood supply, every drop of it, approximately 40 times every single day. They regulate your fluid balance, control your blood pressure, manage your electrolytes, activate vitamin D so your bones can absorb calcium, and produce a hormone that tells your bone marrow to make red blood cells. They are extraordinary, and after the age of 60, they begin to slow down naturally. The filtration rate decreases by roughly 1% per year after middle age. That's normal. But here's what's not normal, and what most people never get told, is that certain everyday habits dramatically accelerate that decline. They take a kidney that's aging at a slow, manageable pace and push it into a much steeper, much faster deterioration. And the morning habit we're discussing today is one of the most common accelerators of kidney damage in seniors that researchers are now paying serious attention to. The habit is this: taking common over-the-counter pain medications, specifically the class of drugs known as NSAIDs, first thing in the morning, often on an empty stomach, often every single day. NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen. The tablets that millions of seniors reach for before they've even had breakfast, because the joint pain, the backache, the hip stiffness is there waiting for them the moment they open their eyes. And these medications work. That's the painful truth of it. They reduce inflammation, they dull the pain, they make mornings livable. But what happens inside the kidneys when they become a daily morning ritual, especially in people over 60, is something that Harvard-affiliated researchers and nephrologists have been raising alarms about for years. And the warning has never reached enough people. Here's what happens inside your body. NSAIDs work by blocking certain enzymes called COX enzymes that produce prostaglandins. Prostaglandins are the chemicals responsible for inflammation and pain. But here is the critical thing most people don't realize. Prostaglandins also play a protective role in the kidneys. They help regulate blood flow to the kidney tissue. They help keep the tiny filtering units, called nephrons, properly supplied with oxygen and nutrients. When you take an NSAID, you suppress prostaglandin production throughout your body. The pain goes down, but so does that critical blood flow protection in the kidneys. In a young, healthy person with strong cardiovascular function and excellent kidney reserve, this temporary disruption is manageable. The kidneys compensate. But in a person over 65, especially one who may have even mild undiagnosed blood pressure issues or the early stages of kidney decline that haven't yet shown up as symptoms. This daily suppression of kidney blood flow creates a slow, cumulative injury that compounds over time. And the worst part is, most seniors taking these medications every morning have no idea this is happening. Their doctor may have mentioned it briefly, once, years ago, or they may have read it on the label and quietly decided it didn't apply to them, because they feel fine, because the pain relief is real, because stopping the medication means the pain comes back, and nobody wants that. I understand that. I genuinely do. Stay with me, because there's a more hopeful part of this conversation coming. But first, I want to tell you about a man named Gerald. Gerald is 72 years old. He lives outside of Pittsburgh, Pennsylvania. He's a retired carpenter. Decades of physical work that left him with 2 bad knees and a lower back that he described as a daily negotiation. About 5 years ago, his doctor prescribed him a stronger prescription pain medication, but Gerald didn't like how it made him feel foggy, so he switched back to over-the-counter ibuprofen, 2 tablets every morning, sometimes 3. He kept his doctor informed, but because Gerald's blood work looked acceptable every year, nobody sounded an alarm. Then, at age 71, his annual blood panel came back with a notably elevated creatinine level. Creatinine is a waste product that healthy kidneys filter out efficiently. When it builds up in the blood, it tells doctors the kidneys aren't keeping pace. Gerald's nephrologist asked about his medication habits, and that morning ibuprofen routine that had felt so routine, so necessary, so manageable, suddenly became the central conversation of his medical care. Gerald said, and I want you to hear this, "Nobody ever told me that what I was taking for my knees was hurting my kidneys. I thought I was just managing my pain." He was. He genuinely was. But the cost was one he never saw coming. Now here's what doctors rarely explain in the detail it deserves. The risk from NSAIDs isn't the same for everyone, and certain factors that are extremely common in seniors stack the risk significantly higher. High blood pressure is one. If you are managing hypertension, your kidneys are already working under increased strain. Adding a daily NSAID to that picture is like asking a worker who's already carrying a heavy load to carry even more weight every single morning. Diabetes is another major factor. High blood sugar over time damages the tiny blood vessels in the kidneys. That damage reduces their reserve capacity. So when an NSAID further restricts blood flow, there is very little left to compensate. Dehydration, something that is extraordinarily common in older adults who often have a blunted sense of thirst, is a third. When the body is even mildly dehydrated, the kidneys are already fighting to maintain adequate filtration. An NSAID taken in that dehydrated state, first thing in the morning before any real fluid intake, can produce a significant spike in kidney stress. And if your morning routine involves that ibuprofen before your coffee, before your water, before anything, you are doing something that nephrology specialists would quietly consider one of the worst possible combinations for kidney health over 60. But here's what I really want you to understand. I am not here to alarm you without offering something constructive, and I am certainly not telling you to simply stop your pain medications without medical guidance. That conversation belongs with your doctor. What I am doing is arming you with information you may have never been given clearly, so that you can have a different kind of conversation with your physician than the ones you've had before. Most seniors walk into their doctor's office, mention that they take ibuprofen occasionally, and the conversation moves on. Very few seniors say, "Doctor, I take 2 ibuprofen every single morning before breakfast. Can you check my kidney function specifically with that in mind?" That is the conversation this video is trying to help you have. Now, what about alternatives? Because if you're dealing with real joint pain, real back pain, real morning stiffness, you need something. Dismissing the pain isn't a strategy. So let's talk honestly about what the research and clinical guidance suggests. Acetaminophen, sold as Tylenol, is generally considered significantly safer for the kidneys than NSAIDs when used appropriately. It does not carry the same mechanism of restricting kidney blood flow. It has its own considerations, particularly regarding the liver, and appropriate dosing matters enormously. But for seniors with compromised kidney function or high-risk factors, nephrologists often prefer acetaminophen over NSAIDs for daily pain management. Topical NSAIDs, creams and gels applied directly to a painful joint, deliver anti-inflammatory medicine locally, with far less of the compound reaching the bloodstream and the kidneys. Research has shown they can be genuinely effective for localized joint pain with a significantly reduced systemic risk profile. Physical therapy, gentle movement practices like water aerobics or Tai Chi, certain supplements like omega-3 fatty acids and curcumin that have mild anti-inflammatory properties, and heat or cold therapy are all approaches that, when combined thoughtfully, can meaningfully reduce the daily dependence on oral NSAIDs. And here's something fascinating that researchers have observed. Many seniors who gradually reduce their NSAID use and replace it with a combination of other approaches report, after an adjustment period of a few weeks, that their pain is not significantly worse. Sometimes it's even better, because chronic NSAID use over time can actually produce a rebound effect, a kind of low-grade systemic inflammation that the medication temporarily masks but does not resolve. When you address the underlying inflammation through lifestyle and targeted alternatives, you are treating the root rather than covering the signal. That distinction matters enormously for kidney health and for long-term quality of life. Let me also talk briefly about something that doesn't get discussed enough: kidney function tests. After the age of 65, the standard recommendation is to have your kidney function, specifically your eGFR, your estimated glomerular filtration rate, and your creatinine level, tested regularly. Not just when something seems wrong, regularly. If you take NSAIDs frequently and have not had a kidney function panel in the last year, that conversation with your doctor needs to happen soon, because the earlier any changes are caught, the more options you have. The earlier you adjust habits, the more healing the kidneys can achieve. The kidneys, unlike some organs, have a remarkable capacity to stabilize and partially recover when the stressor is removed, but only if you catch it in time. A retired school teacher from Georgia named Frances, she's 69, shared something that I think will resonate with many of you. She had been taking naproxen every morning for her hip pain for 3 years. When her doctor ran a comprehensive panel and flagged her kidney numbers, Frances was devastated. She told her daughter, "I thought I was doing everything right. I was walking every day. I was eating better. How could this be happening?" But here's what happened next. Frances worked with her doctor to switch to topical anti-inflammatory gel and acetaminophen. She started water aerobics twice a week. She began drinking a full glass of water first thing every morning before anything else. And within 4 months, her follow-up kidney panel showed measurable improvement. Her doctor told her she had caught it at exactly the right time. Frances cried, not from sadness, from relief, from the realization that she had been given a chance to protect something before it was truly lost. That chance is available to you too, right now, today. You don't have to have a frightening blood test result to take action. You can make the call to your doctor this week. You can look at your morning routine with new eyes. You can ask the questions this video has hopefully equipped you to ask. And you can give your kidneys, which have been filtering every drop of your blood every day for your entire life, the protection and respect they've quietly earned. Your body at 65, 70, or 75 is not a fixed, declining thing. It is a responsive, living system that reacts to every choice you make. The kidneys that are working hard right now will respond to reduced strain. They will stabilize when the daily damage is removed. They will work better when you are hydrated, when the NSAIDs are reduced or replaced thoughtfully, when blood pressure is properly managed, and when you bring this conversation into the light with your doctor. Small adjustments, made consistently, create real and lasting changes inside the body. That is not optimism. That is physiology. I want to hear from you. Have you been taking ibuprofen or naproxen regularly for joint pain? Did you know about the kidney connection before today? Leave a comment below. Honestly, your experience matters here, and your words might give someone else the courage to take action. If you have a spouse, a sibling, a close friend, a neighbor who manages daily pain with over-the-counter medications every morning, please share this video with them. It could genuinely make a difference in their health and in how many good years they get to enjoy. This community exists because people like you show up, stay curious, and care about taking care of themselves. And that is something worth celebrating. Thank you for being here. Please take care of your kidneys. They have been taking care of you your entire life, and I'll see you in the next one.